All right, we continue with Johnson County today, and we're going to visit now about something going on that I was not aware of until recently over at the Western Missouri Medical Center, and we're going to visit with Charlene Atkins about Bridges Senior Behavioral Health, and you are, it says here, the lead social services clinician.
That's right.
Welcome.
Thank you.
Nice to see you. Nice to meet you.
Yes. Thanks for having me.
The word senior behavioral health. Senior, what age are we talking here?
So we are a 12-bed secure psychiatric unit for seniors ages 60 and up.
Got to be at least 60.
At least 60, yeah.
Okay. When you talk to people, sometimes everybody has their own definition of what a senior is.
Sure.
Some places it's 50, some it's 55.
Right, exactly.
It changes.
Sure.
So what do you do? What is this?
So Bridges is part of HCA, or Hospital Corporation of America, and Research Medical Center. However, we are located in Western Missouri Medical Center here in Warrensburg. And we've been, we opened up in December of 2016.
Relatively new.
Yeah, relatively new. And we're here in the community. We are really motivated to help our seniors and people with behavioral health issues, dementias, things like that.
Is that what basically it is dementia, Alzheimer's? As we get old, we don't quite get along like we used to.
Right. Yeah. So we have people with mental health issues, as we said, 60 and up, and they could have depression, anxiety, bipolar disorder, or more organic issues such as schizophrenia or dementias.
Is this a short-term thing, or do they live there?
No, it is a short-term thing. We have an average length of stay of maybe 7 to 10 days. It could be a little shorter. It could be a little longer.
Okay, why would they need to be there?
Well, people come to our unit because they're having some sort of mental health crisis, or maybe they are...
Things like that comes and goes, does it?
Yeah, it can. And, people, we get patients with dementia as well. They may either be living in their home or they may be living in a nursing home. They may even have shown up in an emergency room, and they are possibly having some maladaptive behaviors or just mental health issues that they're just not coping with. So,
if I wanted to go there, do I need to be referred by a doctor? Or can I just kind of show up on your doorstep sometime? How does that work?
Great question. So we get calls from family members. We get calls from the patients themselves. But most of the time we get calls from emergency departments or even primary care physicians within the community. So they call our unit and they, say we have somebody here that is really struggling, and they need your help. They need our help, right. And so we take a referral over the phone, and we get as much information as we can about what's going on. Are they medically stable? And then they need to be cleared in an emergency room or in their primary care physician's office, and then we evaluate them for admission.
Okay.
So.
Is it like psychiatry?
Yes, exactly.
That's what it is, huh?
Yeah.
Okay.
So we have a medical director. Her name is Marcy Shea, and she is a psychiatrist, and she has been working with us since the beginning of the unit. And she's a great medical director, and we do psychiatry.
What's your job?
Well, I'm the lead social worker there, and I do groups, psychoeducational groups, and I also do family meetings and discharge planning. So we want to help the patient get ready to leave and go either back home or go back to their nursing home and have the appropriate resources to do that.
You meet with families. You also meet with the patients there in a group session as well?
We do. We have some group therapy that goes on every day. We have about 3 to 4 group sessions a day where they either get recreational therapy or they get like actual therapy, psychoeducational type therapy, where they meet with one of us social workers and they get information about how to manage their mental illness, or their dementia. So we meet with the family members sometimes if that's needed, and often it is, to provide education and resources for them.
Yeah.
So
Medicare takes care of it?
well, it's covered. We have several insurance plans that we take, but Medicare primarily, yes.
If you're qualified for Medicare. I
Correct,
guess.
exactly. So, and then there are some other Medicare replacements that I believe we take, but that's kind of on a case-by-case basis.
How many of you are there?
That work at the facility.
Yeah,
Yeah, so there's about 25 of us, I believe, that work
Wow,
there. Yeah,
really?
we have registered nurses, we have LPNs, we have mental health techs, and then we have social workers and a recreational therapist.
Is this a separate unit at the hospital?
It is. Yeah, it was an underutilized unit at the hospital at the time, and so they saw a need within our community and said, hey, let's do this. And so they brought it in, and it's been really successful.
But anybody who needs this needs to go through their physician, their family physician, a caregiver or somebody else can take care of it for them.
Yeah, and like I said, they just need to call the unit directly, or their primary care physician can do so. And we just want to take their information and find out what's going on with them, and then want to make sure that they're medically stable so that we can properly care for them on the unit.
And the phone number for somebody who needs to call you.
Exactly. The phone number is 660-262-7590.
7590.
Yep, that's it.
That's kind of odd. The reason I'm laughing at that is that very similar to my number.
Oh, okay, gotcha.
And it rung a bell with me when you said that. But part of it is the first part's different.
Yeah.
Anyway.
Okay.
How many do you have right now, did you say?
We have 20 to 25 employees there right now.
No, I mean patients.
Patients. Right now we have about 6, but we can have up to 12.
Well, why I asked that again was, takes that many people to take care of that few people, that few patients?
Well, we don't have that many people working at one time, obviously, but there's, we have usually 1 to 2 nurses that are on staff at a time, depending on our number of patients that are there, and then a social worker and a recreational therapist.
Are you exclusive to that unit, or do they do other work at the hospital as well?
Some of our nurses in particular do work on other units in the hospital, but I think their primary, purpose
Primary concern is you.
Yeah, exactly.
Okay. We're talking with lead social services clinician, Charlene Atkins, for the Bridges Senior Behavioral Health Unit, which I hadn't heard too much about until we started running a radio commercial for you not too long ago.
Right, exactly.
We run that on the radio, and I was glad to hear that you were coming in today to talk to me about it so I could find out a little more about it.
Yeah, we really appreciate it.
Yeah, nice to see you. Nice to meet you.
All right.
And as far as I can tell, you guys are doing good work over there.
We are. We've had really good feedback from our families and our patients. In our surveys that we get back, we've got about a 98% percentile rank on that.
Oh, really?
And people are really happy with what we're doing, and we're just really excited to be helping our community.
Well, as the word gets out more, you probably get some more patients, some more people who need that service too, I would imagine.
Absolutely, and we're here for our community and want to help in any way we can.
All right. Thanks, Charlene. Nice to see you.
Thank you.
Charlene Atkins guesting with us here on Johnson County Today.